Hi, John Crowley here with McLean County Orthopedics Physical Therapy. Doing a little follow-up to our hamstring tightness assessment, and we're going to take you through some better alternatives. Now, this video is not intended to diagnose, nor should it take the place of any regularly scheduled physician or therapy visits. So if you went through the self-assessment video and you determined that you do in fact have hamstring tightness, and it's not that the hamstrings are on, then we're going to show you another little technique to start to loosen those hamstrings up and promote a little bit better mobility. Presentation, maybe you have a little back pain because of those hamstrings that are a little tight. Maybe you just feel some tightness in there. Maybe there's a little leg pain. Foam rolling is a very safe technique as long as you don't put too much pressure through your wrists or it doesn't bother something else with the wrists or the shoulders. So we've got Tessa here that's going to go ahead and demonstrate this. She's got a standard 36-inch foam roll. Most of them are about 6 inches around, although you could even use a piece of PVC pipe. Anything would really work just to create some compression in through there. So she's going to lift up her bottom just a little bit and put the weight on her hands, and she's going to use her hands and shoulders to actually slide herself back and forth, and this other leg is pulling, and she's creating a little bit of compression in there through the hamstrings. Now when we stretch hamstrings, or when you try to stretch hamstrings, we've got competing agents acting against each other. The hamstrings are trying to pull on the pelvis one way while you're trying to use your core and gravity to pull on the pelvis the other way. So foam rolling is actually a good preparatory technique to any mobility activity that we're going to do, and it's actually a safer alternative than trying to stretch the hamstrings. Is there any discomfort with that? Tends to be a very comfortable activity to go ahead and complete, and we'd have her follow up and do the same thing on the opposite side. And typically we have people do this before any type of increased physical activity to kind of get those hamstrings to turn off a little bit and loosen up. Again, safer alternative to stretching. If you have any other further questions, go ahead and give us a call at McLean County Orthopedics, speak with one of our physicians or our therapists.